Madam President, here we go again. 3 days ago, Democrats voted against a stopgap spending bill that would keep government open for the benefit of 320 million American citizens. But because they voted against it, we're now in a government shutdown, something that should be of profound embarrassment to them, as it is to the rest of us who believe we were sent here to govern, not to shut down the government and deny our own constituents access to the services that government necessarily provides in some cases. Now, if you listen to the media, not all the media, but some of the media, particularly the sympathetic left-wing media, you might think otherwise. But make no mistake about it, the blame for this government shutdown lies squarely on the Senate Democrats' shoulders. 3 Democrats voted to reopen the government the last time we voted. And other Democrats, we need 5 more, will have a chance to vote here in just a few minutes to reopen the government and to stop this charade. But the facts of the matter are pretty straightforward. The reason we're in a government shutdown is because Senate Democrats refused to vote for what's known around here as a clean continuing resolution, a clean CR. As I mentioned, this is a stopgap procedure, so we can then finish the work of the appropriations bills by November and hopefully pass bipartisan funding bills that will last for the remainder of the fiscal year, while we're doing other important work as well, hopefully a national defense authorization bill, hopefully other important legislation. So why hold 320 Americans hostage by denying them the benefits that their government is providing by shutting down the government? Why in the world would you do that? Well, I think primarily what this is because our friends on the other side of the aisle are afraid of their base supporters. We know last time the Democratic leader, Senator Schumer, the senator from New York, agreed to a short-term CR, as we did 13 previous times, because it's a stopgap spending bill. The last time he agreed to a continuing resolution, he was pummeled by his Democratic base. And he's worried that if he does that again, without shutting down the government, without showing some fight, that he will be ousted out of his position as a Democratic leader and maybe even defeated in his next primary election by Alexandria Ocasio-Cortez, AOC. But let's consider the consequences of the shutdown for some of the most vulnerable Americans, our seniors who rely on the Medicare Hospital at Home program and telehealth. Because of the government shutdown, CMS no longer has the authority to reimburse certain telehealth services. Now, most of us were not particularly acquainted with telehealth before COVID, but Congress decided to reimburse healthcare providers for providing virtual visits with your doctors. And in some cases, that's all people needed access to. So it's an important adjunct or supplement to our healthcare delivery system. But that's no longer available because of the shutdown. This will have particularly severe impact on patients without access to reliable transportation, who will not be able to see their doctor unless they can get access to telehealth. Additionally, providers who participated in the Medicare Hospital at Home program no longer have the authority to deliver inpatient-level care in patients' homes. I know we're all concerned about the cost of health care, but if you can treat people in their homes, it's obviously a better place for the patient, and it's less costly health care. But that authority expired with the shutdown of the federal government. This means some of our most vulnerable Americans, sick and bedridden seniors, have been left without care or were unexpectedly forced to be transported to overcrowded hospitals when it may not be in their best interest to actually engage in that transport. But that's just an example of the real-life consequences of this unnecessary shutdown imposed on the American people by Senate Democrats, holding the American people hostage for their partisan political demands, which I'll get to in a moment. Democrats want America to believe that this is about health care. Well, they know that the particular health care benefits that they are most concerned about is a COVID-era plus-up of the Affordable Care Act's subsidies that were started back during the Biden administration. So even if these plussed-up benefits were to expire, people would not be denied access to the Affordable Care Act if they happen to have a policy using that particular program. So there's no imminent threat to these people or anyone else if we don't address it in the context of this shutdown. So it's a made-up crisis. We know that these provisions expire at the end of this calendar year, and there will be time, and we will take the time to deal with those as we should. But based on many of the stories of waste, fraud, and abuse associated with these plussed-up COVID-era Biden subsidies for the Affordable Care Act, there's an important reason why we should take our time and look at these and reform them where necessary. And that's what we intend to do. If Senate Democrats really cared about ensuring the most vulnerable patients in America got access to health care, they would never have shut down the government. This shutdown is obviously not about health care if they're actually making health care worse by shutting down the government. It is simply a way for the Democratic leader to posture at length for his far-left progressive base. It's unconscionable, if you think about it, that Democrats are holding the American people hostage, and some of the very people they claim to be helping get access to health care. Yet they are framing it as though somehow Republicans are forcing partisan demands. But the House has already passed a continuing resolution. The only thing stopping this from making its way to President Trump's desk is a vote in the Senate. And we need 60 votes in the Senate under Senate rules. And right now, 3 Democrats have joined with virtually all Republicans to vote for this continuing resolution, which only will take us to November the 20th to give us time to do the other appropriations bills that I mentioned a moment ago. But the reason why I call the Democrats' demand a partisan wish list is because they're asking for the sun and the moon. First of all, starting with their proposal. Anybody listening is reminded of the fact that we just recently passed the One Big Beautiful Bill, since rebranded to the Working Families Tax Cut Act. But the proposal made by the Democrats in their alternative continuing resolution says they want to repeal it. They want to repeal the One Big Beautiful Bill, which cut taxes for every American, doubled the child tax credit, provided innumerable benefits to the American people, primarily by avoiding about a $3,000 tax increase per family. They want to repeal it. One of the provisions we made in that bill was to limit illegal aliens' access to Medicaid, because some states were gaming the Medicaid program. Not to get bogged down in the details too much, but this is a state-federal program, and under the Affordable Care Act, the federal government pays 90% of the Medicaid. Now, Democrats say, well, it's illegal to provide free health care to illegal aliens under existing law, and it is. But what Democrats were doing in places like California, they were using that 10% state share to fund health care services for illegal aliens. And the one big beautiful bill, the Working Family Tax Cuts Act, put an end to that. So Democrats want to repeal that bill. They also want to repeal the $50 billion Rural Health Care Stabilization Fund. Texas is a big state. We got urban areas, we got suburbs, and we got rural areas. And we need to make sure that people living in rural areas, or certainly outside of urban and suburban areas, get access to health care. And one of the things we did in the One Big Beautiful Bill is provide a $50 billion stabilization fund to make sure they could get access to health care. But Democrats want to give that away. They want to repeal that bill in its entirety. Well, I've heard Democrats on TV and on social media say, we don't want to provide free health care to illegal aliens. But again, this is the provision that they want to change. They want to repeal this provision, alien Medicaid eligibility, which limited the ability to game the Medicaid program, the state contribution to a state federal share program, to fund health care for illegal aliens. Now, we know that there's a lot of reasons why people come to the country, our country, illegally. Many are drawn because they want to work. We understand they want a better life. We understand that, but the right way to do that is through legal channels, not through illegal channels. But one of the magnets that draws people to come to the country is access to taxpayer-provided free benefits, like free health care. But the states like California that game the Medicaid system are the worst offenders when it comes to providing free access to health care using this Medicaid program. But this is a provision that Democrats now want to repeal. The prohibition we passed in the One Big Beautiful Bill, the Working Family Tax Cuts Act. What's more, Democrats are asking us to spend billions of dollars in new spending because they won't vote for a stopgap spending measure. So we know that the Affordable Care Act subsidies, in other words, Obamacare, is enormously expensive. I won't spend much time here talking about the false promises upon which Obamacare was sold. If you like your policy, you can keep it. If you like your doctor, you can keep your doctor. And actually, the claim that it will lower health care expenditures, none of that was true. And Democrats want to put those subsidies on steroids through the Biden-era COVID supercharged subsidy program. And they want to do it not just temporarily, they want to do it for the next 10 years, which will result in hundreds of billions, even $1 trillion plus of new spending. Now, one of the things that we did in the One Big Beautiful Bill was we passed $400 billion in deficit reduction. Why is that important? Because our country now owes roughly $37 trillion. We're $37 trillion in debt. And if we don't do something about that, we're going to be in deep trouble in the not too distant future. Right now, we pay more money on interest on the national debt than we do on defense. in a very dangerous world. That is unsustainable, and that is dangerous. But the Democrats want to forget all that and spend hundreds of billions of dollars in new spending on a short-term, 9-week stopgap spending measure. And they say, if you won't agree with us, we're going to shut down the government. The kind of spending Democrats have asked for would effectively erase all the savings we achieved through the common sense spending reforms in the One Big Beautiful Bill. It is unconscionable that Senate Democrats are hurting the American people because they want more spending for their pet programs. And yet they're framing it as though Republicans are the ones forcing partisan demands. That's false. All we're asking them to do is to keep the government open and pass a short-term continuing resolution that's already been passed by the House of Representatives. The Democratic leader said 2 days ago on the floor, he said, Republicans have tried to stick us with a partisan CR that fails to protect American health care. 3 days ago, the vice chair of the Appropriations Bill said, instead of talking with us about addressing health care, Republicans decided to pass a partisan continuing resolution. Again, that's false. They said they don't want to fund illegal aliens. They said it's a partisan continuing resolution we insist on. Both of those are false. The continuing resolution proposed by Republicans has already passed the House of Representatives. It does not include partisan demands. If Democrats do not want to pass a clean continuing resolution, what are they proposing? Well, a partisan continuing resolution, and I've talked about some of the provisions. The alternative continuing resolution that Democrats are proposing would not only repeal the One Big Beautiful Bill effectively, but they make other partisan demands on top of that. The Democratic CR would eliminate provisions of the One Big Beautiful Bill that are critical to putting our fiscal condition back on track, as I mentioned a moment ago. In the Medicaid program, we tightened eligibility. We added work requirements for able-bodied adults. We required stricter eligibility reporting and ensured that illegal immigrants do not get free health care benefits. The One Big Beautiful Bill was a critical step toward ensuring that Medicaid is there for the people who truly need it, the elderly, children, the disabled, not able-bodied adults. Democrats have claimed over and over again they're not attempting to fund health care for illegal aliens, but as I've demonstrated, that's not true. Their proposed continuing resolution repeals the exact provisions of the One Big Beautiful Bill that prevented illegal aliens from receiving those benefits. Just for those who want to read it for themselves, this is Section 2141 of the Democrats' proposed continuing resolution. It strikes Section 71109 of the One Big Beautiful Bill. This is a provision that limits eligibility requirement and federal payments to states that allow medical assistance for illegal aliens. Medicaid has always been intended to be a lifeline to the most vulnerable Americans when it comes to their health insurance. But over the last decades, it's become bloated with waste, fraud, and abuse. We cannot continue to serve the most vulnerable Americans for whom Medicaid was originally designed if we're going to be subsidizing other people like able-bodied adults who should be capable of contributing themselves. Further, extending these subsidies without reform will continue contributing to the ballooning costs of health care, now roughly 18% of our entire economy. This is the same problem we've had with ballooning costs in higher education. The more the government subsidizes, The more bloated that industry becomes, and consequently, the providers raise prices and those services become less affordable to ordinary middle-class Americans who would not otherwise rely on government benefits. The Republican reforms to Medicaid in the One Big Beautiful Bill put the most vulnerable Americans first. But Democrats have refused to vote for a clean continuing resolution and instead demanded that Republicans repeal these monumental reforms before allowing the lights to stay on. Democrats are also demanding to extend the Enhanced Affordable Care Act subsidies, which is really Obamacare on steroids, which don't even expire until the end of this year. We will get to that, believe me, before the end of the year. But to hold this short-term stopgap spending bill hostage is really unconscionable. To anyone who says that Republicans are proposing a partisan continuing resolution while Democrats are doing everything they can to keep the government open, I hope I've made it clear that the reality is just the opposite. Republicans do not want a shutdown. Shutdowns don't benefit anybody. And the same problem that caused the government to shut down is there staring you in the face when government is reopened. I think we've learned that from hard experience. A poison pill-packed continuing resolution is simply not the solution. So I hope we can get 5 more Democrats to join 3 other Democrats who've already voted to keep the government open to vote this afternoon in just a few minutes and reopen the government for the benefit of all Americans. Yield the floor.